In the UK, there are about 120,000 people with dementia who live alone, and that number is predicted to double by 2039. And people living alone with dementia face unique challenges in accessing assistance and care, particularly if their families are trying to provide support from a distance. I believe that this group of people with dementia are the largest and the most significant and underserved group of people diagnosed with dementia. As a community mental health nurse, I supported many people with dementia who lived alone or their family cared from a distance. There were many challenges to enable them to live as well as possible and for as long as possible in their own homes, and how we could mobilise services to respond, but also be more flexible at times, to be more assertive to meet their changing needs. People living alone with dementia can often fall under the radar after their diagnosis and then only come back into view at a point of crisis, which sometimes is often too late to stop the negative flow of events. What interests us at Dementia UK and Admiral Nursing is how we can better support people who live alone with dementia and access the support of an Admiral nurse, how we can support their independence for as long as possible, and what needs to be in place to reduce inequities of service provision. We have one of our 3 research priorities dedicated to this theme and have welcomed the opportunity to work with Jenny Brooks and her team on this study and see the tremendous value to the guidelines that they've developed for the person living alone with dementia themselves, for people who work with people with dementia, both health and social care professionals, and also in their guidance to commissioners. What should commissioners do to better support people living alone with dementia?